Good afternoon. It's a pleasure today to bring before you guys and ladies Amie Remington. Amie serves as General Counsel for Landrum Human Resources Company, which consists of Landrum Companies Incorporated, Landrum Professional Employer Services, Landrum Consulting, Landrum Staffing Services. Combined, these three companies represent over 600 companies and 10,000 employees. Amie's a proud graduate of Florida State University, where she graduated from the School of... They didn't have a School of Honors in Alabama, so it's the honors program at Florida State in 1991 with honors, and then continued her education at Florida State University College of Law, where she graduated in 1997. As General Counsel, Amie advises the Landrum Companies on all business and employment-related legal issues. She's a regular speaker at national and statewide events, discussing all aspects of employment law that affect all employers, including Title VII of the Civil Rights Act, the Family and Medical Leave Act, the Fair Labor Standards Act, and the National Labor Relations Act, the Americans with Disabilities Act, and the state counterparts to the above-mentioned laws. For more than 10 years, Amie has also served as the Chancellor of St. Christopher's Episcopal Church and regularly provides pro bono legal service to the churches, schools, and child care centers throughout the diocese and Central Gulf Coast. And as our President mentioned, she's here today to talk about the Affordable Health Care Act. So please welcome Amie Remington.
Hi. Well, I can tell you I'm not going to start off with a joke. I'm not a very good joke teller, and if you can't tell a joke, then mine would flop. So I'm not going to start off with that one. But I will note that last week you had the fabulous Ted Kirscher, and next week you have the super cool Blue Angels. And I got sandwiched in between with Obamacare. I mean, that doesn't sound very fair and equitable to me. I'd like to talk to the committee about that. When I was asked to come talk about Obamacare, I had a panic for two reasons. The first is, it's not really a topic that a lot of employers really want to talk about. It's not really a happy conversation to have. And having a conversation that's a downer goes against every grain of my optimistic personality. So it's a difficult conversation for me to have. And the second part is, our resident expert is Ted Kirscher. And Ted has even written a great book that I'll do a plug for. It's available on Kindle. But he did a great book, and he's our resident expert. He began really researching this in earnest back in 2010 when it passed. And he knows everything there is, and we collaborate a lot on healthcare. So if there's a question you ask me today and I don't know the answer, I'm just going to throw Ted under the bus and give you his direct line. But before we get started, I just want to say that although we're talking politics, we are not going to talk politics. This is not a debate. I'm not going to talk about the pros or the cons. We're not going to have a debate. Instead, I'm just going to give you the facts. That's all we're going to talk about today. When we talk about Obamacare, broadly, what it really means is the Patient Protection and Affordability and Care Act, what everybody calls the ACA, right? It also encompasses elements of the Internal Revenue Code, the Title VII, which is the Civil Rights Act of 1964, the ADA, the FMLA. So Obamacare is a lot of laws combined, but most often you hear about the ACA when you're talking about Obamacare. Now the ACA was modeled after the Massachusetts model, which has been around for about 7 years and has an adult coverage rate of about 98% and a child coverage rate of 99.8%. So that's what it's modeled after. But one thing that makes it so confusing is just the sheer volume of regulations. The law itself was mammoth, but the regulations that are coming out and continuing to come out, they're overwhelming. They're coming out every single day. And there are very important topics like non-discrimination laws that we still don't have regulations on, so if you were to ask me a question on that, I would say, I don't know, we'll have to wait and see. And that's what I feel like a lot of the questions I get are, I can say, well, I can speculate, but I can't really give you a solid answer. The other reason that there's a little uncertainty is there's just a lot of terms. And when you're watching TV or you're reading the paper, sometimes the people delivering the message aren't very careful with the terms of art. For example, everybody has heard of the exchanges, correct? Do you know they're also called marketplaces? They mean exactly the same thing. And then there's some soft terms, like when you hear premium tax credit, that also really means subsidy. Or if you hear employer shared responsibility, that's really the employer penalty under the pay or play provision. So that's one thing that makes it so confusing, is there's just a lot of terms out there that are being thrown around, and where you're talking about, for example, essential health benefits or qualifying coverage, we have to be very careful with the terms that we use so that we're talking about the same thing. But today is actually a great day to be here because today is October 1st. And I know everybody here has already given their employees these notices, correct? Y'all have all done this?
Yes.
I see Jim Stolhansky snuck out. He must be doing that right now as we speak. What every employer has to do, regardless of your size, is you have to give this particular notice to every single employee. And there's two versions of this. Your first version is for those employers who don't offer health care coverage at all. And that's going to be a very simple form, 6 or 7 questions, your name, your EIN, you check a box that says, I don't provide coverage. The second form is the same form, but that has questions on the bottom that say, I do provide coverage, and I either provide essential health care, or I don't, or it's going to be affordable, or it's not. And that's a little more complex. Whoever provides your coverage can help you walk through which form you should use, but you have to make sure that every single employee gets a copy of this today. Now, you can do this a couple ways. You can do, if you've got one organization and you're small, you may just want to hand it to them in paper. If you have several organizations and they're spread out, you may want to do it by first-class mail. Or you can do it electronically. If you've got every employee at your business who routinely uses a computer as part of a regular part of their job, you can send it via email, a PDF, whatever, and that's perfectly okay. That follows the ERISA safe harbor rules, and you'll be okay distributing it that way. But if, for example, you have a manufacturing plant or you have the bulk of your employees who don't use computers as part of their regular job, then you can't do that without their consent. And it might be a little late today to get their consent to do that, but you do need to make sure that you get these notices out. Now, you don't have to use this particular form. You just have to tell them what's in this form. But what I always tell people is, if the government's already approved a form, why reinvent the wheel? I would just use the government form. It's a whole lot easier. It's like the FMLA. If you're covered by the FMLA, you don't have to use their form, but you have to tell them everything that's in the form, so why would you reinvent that wheel? That way you know you're in compliance. The form refers to, it's called the New Health Insurance Marketplace Coverage Options in Your Health Coverage. And again, it was called Exchange, now they're calling it the Marketplace. But the idea behind the Marketplace is really kind of cool. It's like Amazon. Say I want to buy a pair of women's Nike shorts in red. I can go to Amazon and I can type in Nike shorts, right? And then it'll pop up all the Nike shorts from all the different vendors. And say I want to narrow it down to red, size small. In my dreams, I would be buying a size small. Say I want to narrow it down that way. Well, then my options would get more and more narrow. And that's the same way this marketplace works. And you put in some other factors like your age, the state you live in, and things like that. But that's the basic idea, is it would help somebody shop, one-stop shopping for different coverage options if their employer doesn't provide coverage or provides what's called inadequate coverage. And open enrollment for the marketplaces begins today on the website healthcare.gov. So if you just want to go Google around on that, it's open today. It wasn't open yesterday, but you can go look at what the options are today. If you walk away with only 3 things today about healthcare, you're going to know more than 90% of America. 3 things. That's all you have to do. 1, about the exchange marketplaces, and we'll talk a little more in detail about that. 2, about the individual mandate, and 3, about the employer mandate. And that's it. I mean, those are the big 3 things that you should really know about today, especially if you happen to be an employer offering coverage. The individual mandate's a little simpler, so I'll start with that rather than start with the employer mandate. The individual mandate says that every single individual in America, with a few exceptions, has to have health care coverage at a certain level. That's basically all it says. Everybody has to have health care coverage at a certain level. And if you don't, there will be a penalty. And the penalty is a sliding scale. It starts in 2014. It's $95 or 1% of your adjusted gross modified income. Have to ask a CPA if I said that correctly. And then it goes up every single year until 2017, when it's about a $700 penalty. And then it's going to be adjusted every year after that, according to the Consumer Price Index. But right now, the first year, it's $95 or 1% basically of your income. Now, the people who don't have to comply with this individual mandate, it's a limited number of people. For example, if you're dependent upon somebody else's tax return, like a child, then you're not covered by the individual mandate. If you're incarcerated, guess what? You're already getting health care coverage wherever you're incarcerated, so you're exempt. If you're a member of a nationally recognized Indian tribe, you're exempt. And there are some other people who, if you're not required for some reason to file a federal tax return, you're exempt. So there are some categories of people who are exempt, but most of the people are covered by the individual mandate and will have to get coverage on or before January 1st. And the marketplaces do open today for them to do some one-stop shopping to look at their coverage. Now, this one's for President Stafford, because I know he's a big Gator fan. We're going to talk about the employer mandate. The employer mandate applies to employers who have more than 50 employees. And the technical term is more than 50 full-time equivalent employees. And this is the part of the law that was delayed until January 1st of 2015. Remember, it was set to go into effect January 1st of 2014, and it got pushed back a full calendar year. So you do have a year now. So I won't belabor the point on how you count people or how you figure out if they're a full-time equivalent. But I will tell you that if you don't have a regular 40-hour-a-week normal workforce, if you have seasonal or variable employees who work different hours, who maybe have gaps in their work because they do temporary work or whatever, that you need to start counting these people, counting these heads on January 1st of 2014, so that when you start counting heads on January 1st, 2015, you'll know whether this employee is one full employee, one half employee, or how you would count that person for purposes of determining 50 heads. If you have less than 50 employees, the employer mandate doesn't apply to you. So the government has, I think this is actually kind of funny, the government has requested that employers voluntarily comply with the coverage requirements and the reporting requirements in the year 2014, but they've said that there will be no penalties assessed for any employer bigger than 50 who chooses not to comply for the year 2014. But they have strongly encouraged that you do this. Now, if the individual mandate is in play and the employer mandate has been delayed, the reality is, at least in my mind, it seems like it will be difficult for individuals to have coverage options. The idea behind putting these two things together was that employers would provide insurance options, individuals would then have a larger place to shop for their insurance options. But the reality is, if the employer portion is delayed, the individuals are going to have a limited number of options out there to provide to get coverage, but they still have to do it. That part of the law is still, at least today, at least as of right now that I know of, is still in play. And I don't see any indication that that'll be delayed at this time. The third thing you have to know after individual and employer mandates is about the exchanges. And as I said, the exchange is your online marketplace with the idea that somebody can go, like I could log on and I could do an apples-to-apples comparison of plans that would provide me coverage for my essential health benefits. The exchanges are either run by the state or by the federal government. And as you know, Florida has opted out, so there is no Florida-based exchange. So if I'm an individual in Florida, I can either go to a third-party exchange, like a private industry group exchange, or I can shop at the federal exchange. Now there are, I think, 15 states plus DC that have state-based exchanges, but Florida's not one of those. What the federal government does offer to individuals is the opportunity to shop on the federal exchange or, as I said, a private exchange for Florida. The federal government also offers the shop option. Have you all heard of the shop exchange? What the shop exchange is, it's for businesses. If you have less than 50 employees and you want to provide coverage, you can go on the shop exchange, and there are some compensation requirements and things like that, but basically if you have 50 employees or less and you want to provide coverage, the shop exchange is where you might go to begin shopping to find out what your coverage options would be. If you don't have coverage through one of your local carriers or local providers. You could go into the shop exchange and start looking at that. But that would give you an apples-to-apples comparison on what your options are. The shop exchanges and the individual exchanges are all opening today, with the idea that open enrollment is today for coverage beginning as soon as January 1st. The federal shop exchange date was delayed until November 1st, so you can still go on and shop around. You just can't make application as a small employer until November 1st for coverage beginning January 1st. As I said, there are 15 states that are currently operating health exchanges, and the remainder have either federal only or some kind of federal-state partnership. And all of the marketplaces can be accessed at healthcare.gov. I'm not sure if you can really log on today and may be overwhelmed. I don't know what the response is today. I guess if the government's shut down, I don't know who's running healthcare.gov today. But the idea is you can log on to healthcare.gov today and shop either as an individual or as an employer to look at what the exchanges offer. I want to talk a little about healthcare deliverables. And this is where I think it impacts each individual. I mean, if you don't own a business, then the employer stuff may not be that interesting to you. If you are an individual who works for an employer that already offers healthcare, the individual mandate might not be very interesting to you. But these are the things that affect every single policy, and so I want to talk about some of these deliverables. Prior to January 1st of 2014, health insurance policies could include dollar limits based on essential healthcare benefits. So if your dollar cap ran out on some of these benefits, your carrier could say, well, you're not covered any longer. But after January 1st of next year, that's no longer the case. And your essential healthcare benefits for those purposes include office visits, emergency services, hospitalization, rehab care, mental health, substance abuse, prescriptions, lab tests, prenatal or young child well visits, those types of things. There's no lifetime limits on those any longer. The other change that affects each individual is when you do go see your provider, beginning September of 2010, this rule went into effect, cost sharing requirements have changed. For example, your copay, your deductible, and your co-insurance for preventive health care and screenings are not permitted any longer, as long as those services are being delivered by somebody who's in your network. And that would include your annual visit for wellness, with the idea that all these preventive cares hopefully can prevent problems in the future. Hopefully if you get your preventive care, ultimately you'll be saving money because you'll be in better shape in the future. Cancer screenings, smoking cessation classes, weight loss classes, well baby and well child checkups, flu and pneumonia shots. Things like that. Things that are designed to create a healthier person down the road. Dependents. Now, when I was 26 years old, my parents had cut me off long before that. But now you don't have to cut your kids off. Good news, they can stay with you till you're 26 years old or even 30 under some policies in some states. But basically, you can be offered dependent care coverage, or said differently, your carrier has to, if your policy includes dependents, the new dependent age is 26 years old. So if your children are married, if your children are not living with you, if they're not financially dependent upon you, if they're not attending their own school, or if they're not attending school because they've already graduated, they can still be covered by your policy. So all of a sudden our children just got a whole lot older, didn't they? Pre-existing conditions. Beginning January 1st, a carrier cannot impose pre-existing exclusions on any enrollees. Currently, the age is under 19. Pre-existing conditions under 19 can't be excluded. Beginning January 1st, the new age is anybody. And I thought it was interesting when I was preparing for this, I found a quote from Kaiser Family Medical that said that approximately 50% of Americans have something that's a pre-existing condition that could prevent enrollment in a different plan. So I thought that was interesting, but after January 1st, pre-existing conditions, they don't really matter anymore. Wellness programs are something I feel super, super passionate about. There are $200 million out there in grants for employers who have less than 100 employees to provide wellness programs for their employees. And there's a lot of different providers in town of these great wellness programs. So if you don't have a wellness program, it may be the applications are out there. You can go ahead and apply and perhaps enroll. The different standards for the grants are out there, but there's $200 million out there for any employer with less than 100 employees if you have any interest in starting a wellness program. I know at Landrum we're doing one. We've had it for a year, and it's been, in my opinion, a great response. I think it's a really, really great thing. Medical loss rebate ratios. Last year, some of you may have received from your carriers reimbursements. And those reimbursements represented monies that weren't spent by carriers on essential health benefits or things that improve the quality of health care. In the small group market, 80% of a premium must be spent on these types of activities that really make healthcare better. In the large group market, it's 85%. And if the carrier doesn't meet that ratio, then the carrier has to rebate the money to whoever paid the premium. Now, in an employer situation, what that really means is that the employer will get a check. And if you're the employer and you pay 100% of premiums, then you can keep 100% of the check. But if you pay 50% of the premiums, you need to split that rebate check with your employees 50-50 and distribute it. And there's a couple different distribution methods to figure out who gets what part of that 50%. So it just depends on how much of the premium you pay as to how you distribute the rebate. But that's when you hear medical loss rebate, that's what that's talking about. W-2 reporting. And this is kind of a mouthful to say, and so I know it's kind of hard to understand. But to figure out how you report W-2 wages in the year 2014, you go back and you look at your 2012 head count. And if you distributed more than 250 W-2s in the year 2012, then when you give your 2013 W-2s in January of 2014, you have to list the value of the health care that you provided, if any, in the year 2013. Is that clear as mud? Okay, good. That's W-2 reporting. Flex spending accounts, I'm sure everybody already noticed this year you're capped out at $2,500. And then the waiting periods have changed. Currently, if you're hired, say you have a plan that has a 90-day wait period, and you're hired on January 15th, then your first day of eligibility will probably be the first day of the next month. That's the way a lot of our plans work. So you're hired on January 15th, you would be eligible on February 1st, so then March, April, and then May would be your official enrollment date, right? That's about 105 days, give or take. Well, the law now says that you have to, beginning January 1, you can only wait a maximum of 90 days. So if I choose to hire this person on January 15th, then they're eligible February 1st. April 1st would be 75 days. I can't go past that 90th day. And your carriers are probably already working on this to restructure your plans to make sure you're not violating this wait period. But just bear in mind that under no circumstance can a person, an employee, wait more than 90 days for coverage to actually begin. Okay? And then if you have more than 200 employees, you have to do an automatic enrollment. Now, your employees can opt out, certainly, but you do have to automatically enroll them. The rate band is what I like to call the slinky provision, because you know how slinky gets big over here and little over here as you expand it and stretch it. And I just spent last night doing wave technology with my 8th graders, so I understand waves a lot better, but it's kind of the same technology. The rate band elimination is, it's a condensation of the way the bands are currently done. Currently, if you have a super fit, healthy person, they might have to pay $1 for a certain coverage. And another person who's not as healthy, say who's on the far end of the spectrum, might have to pay $10 for that same coverage. That's about a 10-to-1 ratio for the same coverage based on an individual's fitness level or health level, pre-existing conditions and all that stuff. But now that pre-existing conditions are gone, that rate band has shrunk to about 3-to-1. So if you're healthier and you're on that one side of the premium, you're going to be paying a little more. But if you're way over here and you're on the 10 side of the premium, you're going to be, that's probably going to be a benefit for you. but the rate band has shrunk from a 1 to 10 ratio to about a 1 to 3 ratio. Let's see. And, Landrum has a ton of sites and things on our site. We've got blogs, we've got videos, we've got the forms for the notices and things like that. So if you have any questions about anything, there are a lot of resources that all employers are welcome to go to and look at. And if you need the forms for today, which I know everybody's already done that, so nobody needs the forms. But if you just want to revisit it and look at them again, they're on the website and you're welcome to grab that. That's not a problem at all. And again, Ted's book is available, and when he wrote it, I have to admit, I was a little jealous because I thought, man, I should have thought of that. You really did a fantastic job of that. So you're welcome to go look at that as well. It really is very, very helpful. And does anybody have any questions? I'm hoping the answer is no. Oh, ma'am. Okay, yes, ma'am.
I think I have two. Number one, our company uses Landrum, so is that something you guys are going to take care of for the employees that are under Landrum staffing, or do we need to be worried about doing all this stuff?
Landrum staffing notices have already gone out, and Landrum Professional has contacted every one of its clients and sent the notice out.
Secondly, how does that affect those of us that are on Medicare?
That's a great question. My dad asked me the exact same thing, so I did some research on that. And the research I came up with was, it's not. Medicare, fundamentally, as I understand it, today, could change tomorrow, will not change. The benefits and the structure of Medicare will not change. Yes?
Okay, follow up on that. If you're on Medicare, one or two of us here are. If you're on Medicare and you have a supplemental, is there anything else you have to do?
I wish I had researched this further, because there is something about that the coverage will eliminate the donut hole problem, and frankly, I'm not familiar enough with that problem to understand fully what that means, but I did read something that said that, that the donut hole problem will be eliminated. And I'll be glad to research that and get back with you, but I don't know the answer off the top of my head. Yes, sir?
What effect will premiums will all this have about eliminating the pre-existing conditions, expanding the age?
Well, I'm not an economist, and so any answer I could give you would be speculative. I can tell you that in my research, I have read things that say that there will be, because the exchanges are hopefully going to have younger, healthier people who are currently uninsured, that they're going to sign up, that hopefully that will wait out some of the people who maybe aren't as healthy. So that will balance the scales. I've heard that one argument, and then I've also heard an argument that we're all more broke. So, I don't have a good answer for you on that, but the Health and Human Service answer that I heard the other day was, if young, healthy people sign up on the exchanges, because so many of them are largely uninsured, that the scale should balance out. But I would have to defer to the crystal ball on that one.
Give them the notice.
If you have somebody on COBRA, I'm sorry, I don't understand the question. If you've got somebody who's currently on COBRA.
Left your business and they're picked up COBRA and they're no longer an employee, who gives them the notice?
Then they're not an employee, they don't get the notice.
Okay.
Yeah. Only for your employees. They would still be covered by COBRA, that's not going to change, and they're still responsible for those COBRA premiums. Yes?
Amie, on the W-2s, are premiums paid by the employer going to be considered taxable income?
It is not considered taxable income, it is informational purposes only, and what it does is it allows somebody who goes on healthcare.gov, an individual who wants to see the exchange, they would put that information in, and then the computer would literally spit out something that says your coverage is affordable, which is 9.5% of your adjusted modified gross income, or it's not affordable, and if it's not affordable, you're entitled to a subsidy, and your subsidy amount is X, which is a sliding scale based on the federal poverty level of between 1% and 400%. Is that more than you want to know? Okay. Are we running out of time? No. Okay. Yes.
One question. I went on a site that I'm a group of, a member of the group, and they said because my business did not have over $500,000 in revenue, I did not Fair Labor Standards requirements, and so I did not need to send letters at this time, sending instructions. Is that kind of what you're doing?
That is counter to what I'm hearing. The Fair Labor Standards Act is the law that applies to every business that engages in interstate commerce in this country. Basically, if you put a stamp on an envelope or if you make a long-distance phone call, you're subject to the Fair Labor Standards Act. Everything I've read indicates that all employers, regardless of size, have to send this notice out. But that at the end of the day, January 1st, only those employers with 50 or more have to comply with the employer mandate. And again, that's now 15 months away. Yes?
Are health savings accounts affected in any way, HSA?
You know, Todd Torgerson told me that if I could answer 1 out of every 3 questions, I'd be batting 1,000. So I'm gonna take pass on that and defer to one of our experts in the room who actually provides health care, because I'm sure we have several. But I can find out for you in all seriousness. Or I'll give you Ted's number.
I just want to tell you one other thing that you might tell the people who are under 65 who have not gotten hit, to be polite about it, with the modified gross income, that you might tell them what it includes now that really kills you. In other words, you add in your tax-free income and you add in your capital gains, and by the time you add that to your salary, you've got a huge amount of money that they're going to be.
See, now I don't have to tell them because you did a better job than I could do. Thank you for that. David, do you have a question?
What's the nature of this coverage? You said your business changes and plans to like catastrophic healthcare coverage plans.
All different types. All different types, but they're all going to qualify as covering essential health benefits. But they're all different types and all different afford limits. Anybody else? Well, thank you. I appreciate it.
Amy, thank you for delivering such a timely topic and a great speech. We're glad to have you anytime. Just a little token of our appreciation.
We're also, something we started this year, we're going to donate a book to a local school in honor of your appearance here. So thank you for being here. Very timely subject, and maybe by the time we get here next week, the government will be back open and all will be well.